Well, good morning and even good evening to all of you joining around the globe. Welcome to our the latest in our thematic innovation ecosystems we've been doing around the subject of skills for health. My name's Andy Bleed and I work for the ESH Alliance. We're a member organisation. We bring our members together in ecosystems just like this. This one is particularly focused on the topic of skills and is led by our ecosystems, great ecosystems in both Melbourne, Australia and in South Denmark. Hopefully today we're going to be very, very light on slides, if any slides at all, because this is about engagement. Our topic today is covering the area of skills and digital health skills needed for managers, following on from previous sessions we've done about frontline workers, carers and citizens. We look to continue these permanent multi-stakeholder gatherings around these topics because we get the message from our members and partners that this topic is crucial for the development of digital health. I'm going to stop talking now and I'm going to hand over to my colleagues who are going to talk us through what we're going to do. But firstly, there's a message from Karen.
Thanks very much, everyone, and welcome to the third event for this year. But before we start, I'd like to do an acknowledgement of country. This is something that we do here in Australia, but I also know that many countries do acknowledge their First Nations people. So I'd like to start from RMIT and acknowledging the people of the Wurrung and Boonwurrung people of the Eastern Kulin Nation, which is where I currently am. But we have a number of Australians on the call tonight, and I'd like to acknowledge where the countries where each of them are and the First Nations people of their countries, as well as the First Nation people across the entire world where each of you are. I'd like to respectfully acknowledge their ancestors and their elders, both past, present, and those emerging, and acknowledge the traditional custodians and ancestors of the lands, waters across Australia, but also across where each of your countries are, where we can conduct business. Now I'd like to hand back to my co-chair, Caroline.
Thank you very much. So this is one in a series of sessions that we've done on skills for health. And this time we're looking into managers as a target group. We've previously looked at citizens and carers. We've looked at healthcare staff, and now we're going on to managers. And the reason why we're looking at managers is that if we're looking at digital transformation, we believe that the managers have a very, very important role in enabling this digital transformation. And usually in these sessions that we do, we start off with investigating the needs. So what is the needs for skills for health? Then we move on to examples of best practice. And then in the end, we look at how to match the needs and the best practices. So we will start off with the needs. And to start this off, we have a colleague from Denmark, Susanne Hoffmann Andersen, who's head of unit at the HR Management Academy in the region of Southern Denmark. So if anybody, she knows the needs of the regional healthcare managers when it comes to skills for health. So welcome, Susanne, and over to you.
Thank you very much, Caroline. So first of all, checking, can you hear me at all? You can. Okay, very good. So good evening, good afternoon, and good morning to some. We are meeting here across time zones, so that's really great. Thank you so much for inviting me. And yes, I know a little bit about what the leaders, the managers in the healthcare sector, they need, and also some experiences we have collected. So I am, as you already said, Caroline, heading our Leadership Academy in the southern region of Denmark. And what we do is that we deliver various leadership programs and consultancy services to hospitals in this specific region. And one of my teams have for the past 2 years delivered a leadership program about digital transformation. And this work has given us some quite interesting insights into both the challenges, experiences, barriers, and also dreams that we have to this specific area. And one of the key learnings is definitely that the digital transformation takes place in very different forms and paces, but the value of leadership is not for discussion. It's so crucial. I would like to start actually with a story. And this is recently shared by a leadership team a leadership team of a department of neurology in one of the big hospitals in Denmark. The reason for telling this story is that it's actually a great example of what kind of leadership that will support the digital transformation. Just to give a little bit of context also about the healthcare system in Denmark, I would just share a few facts that the Danish healthcare system is characterized by universal coverage with free and equal access financed by general taxes. The system is highly decentralized, where hospitals, municipalities and general practitioners, they collaborate to ensure the continuity in the patient care. The collaboration is dependent on good communication between the parties, and here digital solutions like telemedicine or video conferences are adding important value to both productivity and quality. I think that context is important to have in mind just to understand how is it that we actually operate in our country. And the use of telemedicine and video conference has for some time, years actually, been a key element in the digital strategy across the healthcare system in Denmark. And the potential is recognized, but it is easier said than done. And this story is then about how this specific department actually found their way through also what you would see as careful guidance from the leadership team. And today I will call them Elisabeth and Sanna, Elisabeth being the leading therapist and Sanna being the leading nurse. The Department of Neurology, they collaborate closely with the municipalities and about the rehabilitation of patients, for example, after a stroke, when they leave the hospital. So here they are in need of close collaboration and communication. So the leadership team here, they were quite determined to utilize the potential of telemedicine and video conferences. The need, the target was super clear. The technical solution was in place. So what actually worried them was how to convince their employees. And they decided then to focus very much on understanding the mental barriers and the associated uncertainty. Their approach was quite simple, yet effective. They spent a lot of time having conversations with their employees to understand the needs and concerns. And the dialogue showed that it was super important that Elisabeth and Sanna were present during the implementation. So they were present during the first sessions to support the employees and also to learn together with them. And here the employees came up with some rather modest and simple requests that was easy to develop, like standard video links and a hotline to IT help desk. It was not rocket science, but it was important to the employees to lower uncertainty and anxiety. So what we saw here in this example was that the management actually identified the needs and they acted on them. And they saw the importance of, for example, this thing about establishing an agreement with IT help desk to make sure that within a few minutes they could be there present in the department if the employees needed any help. So this was a way for them also to lower the level of uncertainty and fear, because of course the employees, they want to do their job and they want to do good. So how can they actually also have good structures around that? This short little story is actually a story that pinpoints some of the focus areas for leaders to drive the digital transformation. And I will sum it up in 3. The first one is how to strategize. In this story, the department identified an opportunity based on a need, and they also identified the solution. And what leaders need to do is that they need to engage in the translation of strategic targets to see the potential value creation within their specific functional domain. The technical solution might seem very obvious, but the value creation has first to focus on the needs and competences of the patients, the employees, and also other stakeholders taking part in the patient care. So to strategize in this context is to continuously work with the important strategic focus areas close to the daily operation and pay careful attention to how the needed changes are supported by culture, working routines, competences, and structures. So that was the first one. The second one is related to imagination. So how to imagine, how to envision what comes next. So we see a need for teaching our leaders in how to zoom out and explore what could be next from a holistic perspective, especially when we realize that the current setup is challenged, or maybe it's not even working, or maybe there's a lack of resources or competences. What do we do then? So what has worked until now might not be the recipe for the future. So the ability to stay curious and deal with scenarios for the future from the perspective of the patients and the employees is essential. And this could also be a way, an approach to start seeing the upsides of uncertainty and not just the downsides of it. The third one and the last one for today is how to make it safe. The leaders are likely, and we hear them also reporting this back to us, they are likely to feel both incompetent and insecure if they think they need to be specialists within IT and tech. And they don't have to be the experts, but they need to be able to build networks with access to knowledge. They, on the other hand, need to be the experts in the need and expectations of their patients and employees. And at the hospitals, there is every day a lot at stake with focus on the patients. We don't allow mistakes to happen. So it is therefore only natural that employees and managers are hesitant toward change if they see any risk. So here the leaders have an important role in making it safe when exploring new ways of working and experimenting with digital solutions. The successful use of digital solutions and implementation is very much about ensuring this sufficient level of competence and clear organizational setup. And then we shouldn't underestimate how much time it actually takes to develop new competences, learning new systems, learning new methods, and to find the appropriate structures for these new routines. I hope this short little story and these pinpointing out these 3 focus areas are of any inspiration to you. So thank you so much for inviting me.
Thank you so much, Susanna. So basically what I gather from you is it's very important to think about the leaders' roles in strategizing, in imagining, and in making it safe for everyone, and to not underestimate the time needed to actually develop these competences that we need. Yep. Thank you, Susanna. So next off, we have Sebastian Isabel from Australia, from Emerson Health, who will also tell us a bit about the needs for digital skills for health managers. So over to you, Sebastian.
Thanks, Caroline. Hi, everyone. As mentioned, I'm Sebastian Isabel. I'm a senior consultant at Emerson Health, which is a boutique management consultancy that specializes in the healthcare industry. Emerson Health does a lot of work in the virtual care space, and last year we undertook a project with New South Wales Health and the Agency for Clinical Innovation to develop a capability blueprint of the skills and capabilities required to effectively deliver virtual care and how to sustainably integrate it into business as usual healthcare provision. So I'd like to take this opportunity just to speak to you about how we developed this capability blueprint and what are the specific skills and capabilities that we identified that health managers need to enable effective integration of virtual care across the workforce. So this project was undertaken over approximately a 6-month timeframe and incorporated 3 key components. The first was a literature review. We were fortunate enough to utilize the skills and expertise of Professor Karen Butler-Henderson to assist in conducting a highly comprehensive literature review that encompassed more than 90 documents across academic peer-reviewed and key policy and strategy from government and health bodies across Australia and internationally. The second component was stakeholder consultation. So we completed interviews with 85 stakeholders from all districts and networks and representatives from New South Wales health pillars and statewide services, which included clinicians, administrative staff, managers, and their executives. And the final and third component was holding 2 large virtual workshops with 90 individuals across both workshops to firstly explore the current state of virtual care in New South Wales, and then to co-design an ideal future state for effective virtual care integration. So all the insights that we generated from these 3 components were then used to develop the capability blueprint. In total, we identified 10 capabilities and listed the expected outcome for each, as well as potential actions that could be taken to uplift each capability at a foundational, adept, and highly advanced level. So I'll take you through each capability. These are not presented in any particular order. And I'll also provide just an example of an action that managers could implement for each capability to uplift virtual care delivery within their workforce. So the first capability is digital participation. This is the ability to be actively involved in digital ways of working through the uptake of modern information and communication technologies in health. So an action to uplift this capability could include planning or hosting virtual town halls where staff can hear from peers or experts on the importance of virtual care in health, for example. Or it could involve instructing that digital projects have a co-design or consultative aspect to provide opportunity for further stakeholder participation. Capability number 2 is professionalism. This is the ability to practice ethically and professionally and showcasing behaviors that uphold and promote the values of an organization. So actions to uplift this capability could include developing and disseminating etiquette guides for delivering virtual care, or creating a culture that supports and recognizes virtual care skills and capabilities. Number 3 is interpersonal skills. So this is the ability to effectively communicate, influence, and build relationships with others. So this could be action through providing formal introductory training on virtual communication, or enabling structured mentoring to uplift team interpersonal skills and expectations of managers. Number 4 is patient focus. So this is the ability to provide patient-centered service, encourage patient empowerment, and uplift patient e-health literacy. So this could involve considering leveraging CPD framework where virtual care patient focus modules count towards an individual CPD points, for example, or designing an inclusive forum for regular sharing of experiences or knowledge with interested parties. Capability number 5 is quality and safety. This is the ability to deliver the right care in the right place at the right time to support equity of access in a manner that's safe for all involved. This could involve ensuring that clear etiquette guides exist, outlining the different quality and safety considerations for virtual care, and that these are accepted and disseminated across the workforce. Number 6 is innovation. So the ability to contribute to the development of new or improved ways of working with a focus on virtual care. So this could involve creating an environment for innovation where you remove any unnecessary barriers that enable change to happen, while encouraging leaders to fail fast and learn from those mistakes. Number 7 is digital literacy. So the skills to navigate digital tools, awareness and knowledge of digital security, and digital health ethics. So this could be action through ensuring a digital champion is available to the team, for example, so that curiosities about the possibilities of virtual care and digital health can be positively directed. The digital champion can then also support day-to-day questions and uplift opportunities for exploration and implementation. Number 8 is data and analytics. This is the critical appraisal of information and data, enabling quality improvement, service planning, and delivery. So this could involve designing and delivering basic training on data analytics, such as including what is data analytics, basic data retrieval, and foundational analysis for all employees, as well as best data practices. Capability number 9 is change management. This is the skills to effectively support people through the transition or transformation of processes and technologies. So this could be action through teaching relevant change approaches in virtual care, through providing further training that takes into consideration the health context and defines best practice for engaging with different stakeholders in the health ecosystem. And finally, capability number 10 is leadership. So the ability for an individual to influence and guide groups, colleagues, followers, or other members of a department, service, or organization. And as an example, this could be action through supporting individuals to engage in self-driven development, which may include reading books or listening to podcasts on leadership or facilitating networking and mentoring opportunities. So that's just a quick snapshot of the 10 capabilities that we identified, and just an example or two of an action that for each that a manager could implement to uplift virtual care service delivery within their workforce. Thank you. I hope you found that helpful.
Thank you very much, Sebastian. So interesting to hear about your capability blueprint and going from the current state to the ideal state and the identified 10 capabilities. So maybe that's something that people can find also online after to dive further into it. If it is possible, then maybe you can put a link in the chat box. And just in general, you are welcome to ask any questions in the chat box or comments or anything. Also, as you can see now, we've put in a link to a Padlet in the chat box, and so we would like to hear from you guys. What you think is missing. What knowledge are we missing when it comes to skills for health for managers? Is there anything that we don't know at current? So please have a look at the Padlet in the chat box. You click on the link and then you can enter it. Are you going to share it as well, Adriana? So we can see it?
Yeah, I can.
Thank you. And we're going to do this after both this section with needs, and we're also going to do it after the section with best practice. So you can already start thinking about the next question as well, which will be, what barriers are there for managers to increase their digital skills? So, but let's look at the first one with what knowledge are we missing? Thank you. I can see that there are 3 dots going, so people are writing something. Here we go. So some data science skills and negotiation, yeah, with the suppliers. And looking into the future, yeah. So what will the needs be in the future, and how do we actually prepare managers for what will happen then? That's a good point. Yeah, I see there's still a couple of people putting things in, so I'll just give it a minute, but maybe we can also return to this after we've gone through the next section. So does the manager need to interpret the data or just collect it? That's also an interesting point. So thank you. You can keep writing things in here and we will look into it at the end. And now I will hand over to Karen, who will introduce the next section of today.
Great, thank you very much. So our next section that we're looking at is under the title of What Does Good Look Like? And our first speaker for today that we have speaking on what it takes to manage or the upskilling of the digital skills of managers or of the healthcare in general is the CEO of the Australasian Institute of Digital Health. I have Dr. Louise Schaefer as the first speaker, but I see Randy's on my screen, so I will just clarify if Randy's actually going first. Yes, no, I will introduce Randy first then. So Randy Lehmann-Boesen is the Innovation Consultant for Health Innovation Centre of Southern Denmark. Thank you.
All right, thank you very much, Karen. Hello, everyone. Thanks for inviting me again. This time, I'll just introduce myself quickly. I'm an anthropologist working here in the healthcare sector of Southern Denmark. I've been focusing a lot on research projects on digital skills and doing training programs on digital skills for healthcare professionals. So what I would like to talk to you about today is advice that I've received when doing these research projects, talking to healthcare professionals, healthcare managers, professors and teachers in the hospitals and in university colleges on digital skills and being a manager in this digital transformation. What are the best advice they can give on how to support healthcare professionals in becoming really good at using digital solutions and wanting to use them? But before introducing their advice, I'd like to introduce you to a research project we've done on more than 400 healthcare professionals and managers across Europe, where we've asked them different questions related to digital technologies and digital transformation. And what we've asked them is, among other questions, like what are the biggest potentials when it comes to upskilling the digital skills of healthcare professionals? What is the biggest potential here? And what they say is generally that it's about changing the mindset and the attitude of healthcare professionals towards more curiosity, interest, and open-mindedness, because many are very reluctant to replace the physical meeting with the patient with technology, scared of the changes that we've heard earlier. And the other point they all mention, well, almost all of them they mention, better training. We have to make better training. It has to be more structured, because now it's mostly unstructured. It's there's no clear structure. It's learning by doing. There's a lack of time and resources for this to happen. So back to the advice we received from healthcare managers. So what are their advice in changing this mindset of healthcare professionals and enabling better training? And I'll divide these answers into 4 categories. One is what, then it's why, then it's how, and lastly, who. So what is about what to focus on when being a healthcare manager? Which kind of technologies, which skills? And what they say is you have to focus on the technologies that are already in the clinical practice or are going to be implemented very soon. And when I say very soon, it's within this week. Because if you teach people on digital technologies, it has to be hands-on. And if you teach in something that's in the future, like 2 weeks ahead, you'll lose so much. So it has to be something you use today or can use today or tomorrow, and it has to work. If it doesn't work, you just create a lot of reluctance and a lot of fear and negativity. The next is why. And they said this is just so crucial. And this also was highlighted by our first speaker, this value creation. Understanding why is this technology important? Why should we use it? Why should we change our ways of doing? And here, it's a good idea to focus on like, what's the value for the patient and for you as a healthcare professional. And the value for the patient can be, for example, as I heard a neurologist say, that actually he had some patients who, when asked, they said that when receiving their diagnosis, which could be a really hard diagnosis, they would actually prefer to sit at home in their house with their relatives around them instead of being in the hospital. And that was very new to him. That was eye-opening, that could be a value for the patient. And it meant a lot to the people he was working with, that could be such a big value for the patient. Also a truck driver we talked to, he said that if he had to go to controls all the time in the hospital, he would just use so much income. He wouldn't be able, he was freelance. So he would probably have to sell his house in the end because he wouldn't be able to generate enough income. So this why is so important for the healthcare professionals to understand. Why should I do this? The next is how, and how might be just doing some training, but it also has to be creating possibilities for the healthcare professionals, not just to learn about this technology, but also be able to practice and practice and practice. As we heard Susanna, the first speaker, said, make it safe. And that's what we hear all the time. Create a safe space, like a stress-free environment where the healthcare professionals can train and try, press the button you don't know what is for, and do this in a way where you don't damage patients, where you feel free, you can try, make mistakes, share experiences with your colleagues, reflections on where does this technology work for you, how does it work, and it could also work in this way, and we found out that this kind of patients also like this technology, and so on. And maybe you have to schedule maybe an hour a week for a group of healthcare professionals where they can try, and it has to be in a way scheduled, so it doesn't just it's not just forgotten in the everyday work life where there's a lot of other things going on. Lastly, there's who should be involved in these and have responsibilities in this teaching and training. And here there are 3 roles that they highlight. One role is sort of the teachers. It's a good idea to have sort of some who are sort of the teachers, a team in the hospital, in the department, in the ward, who can go out to the teams, to the different departments one at a time and do hands-on training with healthcare professionals. and who can also become really good at it. And then there's the role of the manager. It's really important that there's someone to set up the goals. How much should we use this by when? And who can sort of give attention and say, hey, good job, you did it. I mean, I saw you made a video consultation the other day, and wow, good job. Even if it was hard, you tried it out. And hold focus and sort of emphasize that it's okay to make mistakes. It's okay that it's difficult. I understand you guys. And then the last really crucial role is the support. Also, as I heard the other previous speakers say, if there is no one to ask questions when you are a healthcare professional and you're in the situation, you're using this technical solution, it doesn't work. If there's no one to ask, then you won't use it again. Is what we hear all the time. So there needs to be, it can be employees who are specialized in this, or it can be the ICT department. As Susanna said, a good relation with the ICT department is so crucial. But just be sure that there is someone that you can ask questions, the healthcare professionals can ask, and can help them when they need it. So these are the main advice I've heard and that I'd like to give on to you. And then I'd like to end up with a quote from one of the healthcare professionals we've talked to, who says that when we implement a new medical technology, we always make sure that staff is properly trained and don't make mistakes. But when it comes to medical technologies, why don't we do the same thing? So thank you very much. And yeah, those were the advice from our healthcare managers.
Wonderful. Thank you so much, Randy. So our second speaker in this section is Dr. Louise Schaefer, who is the CEO of the Australasian Institute of Digital Health. Thanks very much, Louise.
Thanks, Karen, and thanks ECH Alliance and Karen for having me here today. I'm very excited because this is my first international Zoom from my new office, so I hope you guys can hear me okay. So I run the Australasian Institute of Digital Health, and we have upskilling the workforce and building workforce capability as one of the core strategic pillars of why we exist and what we do. We're a membership, non-profit based organisation, and we started life 30 years ago running conferences and bringing communities together, and we still do all of that work, but our mission has advanced a lot because you know what's really cool, and I hope you guys, wherever you are all around the world, are seeing the same thing. People care now. It's not just us talking amongst our own friends and, 3 of us getting on these webinars and, we all go, yeah, people need to be listening. So we do find that generally healthcare system in Australia has increased its awareness of how important digital is. That was happening already, but the pandemic has actually really changed things, and I know it has everywhere around the world. We had Sebastian's talk earlier looking at competencies specifically around virtual care, and I'm sure similar things are happening in your part of the world as well. But it's so nice that it's not just a small group of people now caring about digital health and why these things are important and why conversations like the one we're having today is critical. We see our role as very much setting the standards. So making sure that we define those digital professional practice standards for the entire healthcare workforce. And of course, management and executives are a part of that. Provide credentialing, which actually gives us recognition to individuals that they know stuff and that they've achieved a certain level of competence, and give them recognition for that, which is really important to people as individuals. And it's also important for employers as well to recognise and to recognise how important digital is in the skill set. And we do some other things as well. So one of the things in terms of management workforce, and I think that it's really, we've still got a long ways to go. I'd certainly love to hear from anyone else who think you're more advanced than us and you've nailed it when it comes to digital health for executives and management. But these people usually find themselves in those roles because they've sort of grown up in the sector. We sort of find 2 things. It can be management that, they might have been clinicians or other parts of the healthcare system, and they've worked their way up in time into management and executive roles. And also sometimes we'll import someone from another industry into the healthcare sector. I always feel very sorry for them because health is just such a unique beast with our wicked challenges that never seem to end. So acknowledging the important role that digital health plays is important for managers and executives, I would argue more so than necessarily other parts of the healthcare system. And that's because these people are in rooms, sitting around tables, making core decisions that impact their delivery of care, and that could be in the hospital, in the community, government policy, aged care, mental health. These people are making core decisions about service delivery, but also their workforce. It's like, who do you want to build a team, or you want to upskill your team? Well, what do they need to know? You're recruiting. What sort of skills are you looking for? And it concerns me that globally we're still at an early stage of the evolution of looking at competencies for managers in digital health. So, things like leadership and, professionalism and those sorts of things have been around for a long time. But what is it unique about your role as an executive in healthcare that has a particular digital health remit? What is it that you need to know? And if you don't know that, some of the other speakers have spoken, you're not going to feel confident in yourself. But also you need to be confident because you're the one making decisions about building teams and upskilling your teams. And so I think we do need, I sort of congratulate ECH Alliance to bring this event together, because it's something that we need to do a much better job of. And I think it's a global need. Randy before me spoke about the importance of behaviour and changing mindsets. That is so critical. And as a leader, that's maybe not so much as a manager, but as a leader, that's a core component of your job as a leader in any sector. So if you don't understand the landscape and the future of where your health service is heading and the challenges that are going to be posed by some of those futures, how can you possibly provide the leadership that's required to take your staff and your team on that journey, and indeed to convince the powers that be, it might be a board or upper levels executives, of the need for these changes? I'd certainly agree with some of the comments that were on the Padlet earlier about things like negotiation. That's really important. Procurement is really important. So a lot of us don't think about procurement, but I remember talking to a healthcare executive in Victoria, where I live, not so long ago, and they'd done a digital hospital. It was all very exciting. Anyway, and so we were doing a tour, and I had a chat with him after, and they even had those robots that deliver food and stuff like that. Well, they call them robots, but anyway, so they were doing humans out of a job. But anyway, I was like, oh, how's it going? And he said one of the things he didn't recognize would be hard. He said, you go through these massive procurement protocols, and you before you even get to procurement, you work out, well, functionally, what do we need here? What does the team need? You pull all this information together, you agree on a procurement framework and all those, legalistic processes you need to follow and contractual processes you need to follow. And he said, but at the end of the day, he said, it's a bean counter, meaning, it's someone that controls the purse strings that decides how much money is spent and what gets cut out of the budget. And he said that he thought he had failed, and this was something retrospectively, because while he was successful in getting his business case approved to invest in digital, and when I met with him, they were still in the process of taking their staff on this journey. But he said where he felt they really failed is not actually educating the finance people and the lawyers. He said they're not healthcare delivery people. It didn't even occur to me. And so he actually sent lawyers and accountants to do the certification that we run here in Australia. So it's a story that stuck with me, because you wouldn't think, well, we didn't necessarily think that we built these things for an accountant to do. But he said if they don't understand what we're trying to deliver, the challenges that we currently face in the future, and if they don't understand that, they don't have an appreciation for what's required. And so it's easy for them, to go through a budget and take out line items, which is stuff that's really critical. And he said, we're going to struggle now as a result of some of that soft systems and the training that got taken out. So he was finding it very challenging to, upskill the workforce. And that was what he was in the midst of. So I thought I'd share that. And then one other thing, and I'm just going to flick so I've got it open in front of me. Something that we did, and it's not published yet, but there's a PhD student in Australia called Mark Romeyer, and he's attached to Flinders University, and he lectures as well. He's he's been around longer than me, I think, doing digital health. But he's found this and Karen and I know Mark well, he found this whole thing very frustrating. So he's actually decided to do a PhD, even though he's at the level of executive sort of himself. But he said he spent so long in the healthcare system and being very frustrated that people get management roles and they don't necessarily understand the digital health context of the health service. And without proper understanding of that, but also support for those people in those roles, it makes it very hard for them. So he's actually doing a PhD building competency frameworks and testing them for digital health executive or for healthcare executives. But what does a healthcare executive need to know about digital health to be the very best healthcare executive he or she can be? And so that's one of the things that I would call out, and it's certainly something to keep an eye on his work. But we did do some work on building competencies ourselves, and this is something that we did a few years ago. It wasn't published because COVID got in the way, and we have a community of digital health executives that helped build this and give us feedback. But I think things have changed significantly, so we want to go back and revisit this work and also use the context of Mark's PhD as well. But the competencies that were called out in that framework was firstly ICT governance and management, and a whole bunch of things you'd expect to find under there. 4 competencies that were related to data, information, knowledge, governance and management. 3, there were 6 competencies related to program and project management. And there was a whole bunch of general management stuff. So that could be innovation, ethics, problem solving, communication, people and organizational development. But again, those sort of standard leadership and management type competencies, but how do you apply that knowledge in health and specifically around digital health? And then there was also the final competency was around executive management in health. So that was, corporate governance, understanding that you really understand the healthcare sector that you function within. So yes, I look forward to hearing more about what's happening around the world in this topic. And thanks again for having me.
Great, thanks very much, Louise. And just noting as well, George Margelis has just also agreed with you. The AIDH, Australasian Institute of Digital Health, has played a significant role in this ecosystem here, not just in Australia, but across Australia, New Zealand and the Australasia ecosystem. So thanks for that comment, George, as well.
Thanks, George.
And our final speaker for this section is Karen Melcher-Janssen, who is presenting as the Digitisation Advisor. Thanks very much, Karen.
Thank you. Thank you for inviting me to this exciting event. I am an independent consultant, and I have more than 20 years of experience in digital leadership in the public sector in Denmark, both in municipalities and in hospitals. And for the last 5 years, I have been teaching about 1,000 public managers and leaders in how to understand their role in the digital transformation and how to use specific tools to do so. And I would like to share my experience with this. My first experience with the development of competences for managers in the healthcare system consisted of 2-day physical workshops in the north region of Denmark. That's the hospitals in the northern region of Denmark. That was in 2018 to 20, until obviously stopped by the pandemic. I was the main architect and the teacher of these workshops, and they consisted of an e-learning course for a start. Then we had 1 day of practical workshop learning about digital leadership and getting an introduction to tools from service design. Then the participants had 2 to 3 weeks where they had to apply some of the tools in the workday at home. And last, we had 1 day of a workshop again, where the participants would demonstrate their findings and also getting an introduction to some of the technologies at work within the healthcare sector to give them some inspiration. The participants of these workshops were the managers that are closest to the operation, which is primarily the chief physicians. We had senior nurses and the leading medical secretaries. And for these courses, they were encouraged to sign up as leadership groups, but it was also possible to attend the workshops individually, which a lot of them did. So it became clear that it was an intentional choice for a lot of the leadership groups to simply send one to attend these courses. And it was primarily nurses who signed up, we found out. The workshops were built around specific tools based on service design, as I told you, which the participants had to apply to their own cases. And the experience was that a lot of the participants found it difficult to find a suitable case to work with. The participants found it difficult to see digitalization as a task for the manager and leaders that went beyond acquiring user skills to use the systems. So an area where it succeeded the most was when the leaders had brought a key employee, for example, a development nurse, who could ensure progress between the two workshops, where they had to observe the patients. And after the workshops, the key employee could continue to work on the case they had chosen. So that was a big finding. So after this experience, we started to encourage the managers to bring a key employee with them to the workshops. Another great learning was that the great results came from mixing the participants across different departments from the hospitals. We made some learning groups based on which department we knew that they had processes that overlapped. This meant that the participants became aware of the cross-cutting processes from the patient's point of view, and that they could work on improving them using the digital technologies. That was another great finding of these courses. Since then, I have held several courses with a mix of live online workshops and physical workshops. I have also built an e-learning platform with courses targeted to leaders and managers who want to understand and develop their own role in the digital era. It is my experience that developing these digital skills works very well as blended learning. Among other things, I have collaborated with organizations to use Microsoft Teams as a part of these online workshops, which positively has pushed the adoption of Teams in these organizations. So the online interaction has been an important element in this. Also in collaboration with the region of Southern Denmark, where Randi and Susanne are also been collaborating with them. I have been involved in testing a format where we broadcasted live to a large group of managers who were placed in physical locations in different places in the region. There wasn't a great opportunity to interact in this format, but in return, I think we reach a lot of people. My experience is that if there must be interaction in online sessions, there must be a maximum of 25 participants. That's my experience. And also that an online session must last a maximum of 2 hours. And in those 2 hours, you must have plenty of variety, theoretical presentations of a maximum of 10 minutes, then some exercises, polls, chat, group exercises, etc. So in summary, I would say that the good development of leader competencies in the health sector is you have to link it to a specific project that the participant must work on a specific project which they choose themselves or is given by the top management. Number two, it has to be extended over time. You have to spread the learning about from maybe 3 weeks to 3 months, where the participants will work with the project alongside with the development of competences. And also number three, it has to contain specific tools. I use the tools from service design, and then the participants can practice them using in their everyday work life. So another question that I will briefly discuss is, what is the manager's task in the digital transformation? My experience is, based on practice, is that the managers who succeed the most in navigating and learning the digital transformation are those who have the courage and the curiosity and drive, some of the things that also Randi mentioned. So you could say, click it till you make it. That's a good phrase, I think. So they must have the courage to initiate trial actions, even if there is no evidence that it works. And that is a major cultural barrier in the healthcare sector, at least in Denmark, because the healthcare sector is naturally driven by evidence and a scientific approach. So that's why it's also important that the managers have support from the top executives and supporting them that it is okay if mistakes happen. So the balance is to try out digital possibilities on a small scale as a start. Another experience is that it's important that the managers understand their own role and responsibility in developing the core tasks. The digital technologies offer new ways of organizing the core tasks in the healthcare sector, and that the IT department can't solve this for the professionals within the healthcare sector. The IT department can make technologies available, but it is the leaders and managers themselves who must link the development of their core tasks with the opportunities that digital technologies offer. And that's the help they must have through their development of competences. They need help to acknowledge this. So in summary, I believe that there are 3 questions that healthcare managers must be able to answer. The first one is, what kind of value do I want from investing in these digital solutions? Number 2 is, how will I work to lead the changes that digitalization brings? And number 3 is, what can technology help me and my employees and in my department? So this was my brief talk. Please reach out on LinkedIn if you have any questions afterwards. Thank you.
Thank you, Karen. And congratulations, they sound like really great, with some great outcome courses that you have. So that brings us to the end of the first section, for the second section of tonight's event. And it leads us to the second Padlet, which we've already posted onto the board, onto the chat. And we've already seen some responses from our participants. The question was, what are the barriers for managers to increase their digital skills? And thank you, Adriana. It's just popped the link back in the chat again so you can access it. Adriana, we might pop back to the first Padlet whilst people are putting in their answers on this one, because we've had some more responses come in here. And Caroline, I don't know whether you'd like to go back and talk a little bit more through this one whilst people are posting on the second one.
You go ahead. I'm letting Randi use
That's
my
okay.
computer.
Okay, so some of the things that Louise actually highlighted, some of the topics on here, you know, for example, change management, negotiation, etc. Procurement is one that I also saw on here and thought that was really interesting, because they are these decision makers, and being able to understand the technology that's being proposed for them to either include as part of their strategy or to just approve in terms of procurement is really important. And that goes back to this Digital Health 101 comment on here. I'm really interested in the help desk and secretary involvement comment as well. And I think that links through to what we will start discussing in a moment around the barriers. The comment around leaders need not be tech experts is another important one we've heard today. It was about who you surround yourself with, but also being able to have enough of an understanding to be able to be an enabler in that area. And then linking digitalization to day-to-day practices. And as we start seeing more and more of digital as well as data-informed decision-making being required as part of the health service managers' roles, we're going to see more and more of that coming through. In terms of the barriers, as I said, we've already started to see some of those barriers link through to the other Padlets. So for example, I'm trying to see the one that I saw. Oh, that's right. The comment around this, tech support and secretary comes through really clearly here in that, the managers only have a limited amount of hours in the day. So it's about deciding what you become an expert in as opposed to what you become, good enough knowledge in, and then surrounding yourself with the experts. And there's certainly been a lot of talk here in Australia about what is good enough. And so that sort of comes into that allocated time, focus. The not seen as important is an interesting one because we're really starting to see that change as we moved more as a digitalized society, and certainly as managers are having to use data to inform the decision more and more. And I think that's really going to come back to that stick and carrot comment as we need to make more real-time data-informed decisions as opposed to using that historical data or activity that occurred 12 months ago informing our decisions. As we start moving towards that real-time data-informed decision-making, that becomes more of the stick. I certainly used to do quite a bit of work up in New South Wales, and one of the chief operating officers used to have a Star Trek panel sitting in front of them of 3 different screens. And whilst we'd be meeting with her, she would say, stop for a moment. And then sure enough, the phone would ring, or she'd pick up the phone and it might be down to emergency department and say, right, do you need some more staff down there? And it's because sitting behind us with these panels that could show us exactly what was happening in any department, or data informed, what was happening in any department at any time. So for example, an emergency, it might be all of our category 1 and 2 triages were increasing in numbers. Ambulances might have been ramping, and she could see immediately that she needed more human resources down in that emergency department and could quickly make that decision, put that into place as opposed to waiting for a report to come through in 12 weeks' time. And egos in the ecosystem. That's a really interesting one. I think this goes back to, I heard Louise talking about us working collegially and collectively together, and just noting that comment that George made. I hope this is something that eventually go on, Andy, turn on your microphone. Do you want to talk about that one?
Of course it's about bloody egos. That's the trouble with working in health. We think we're that special, that wonderful because we're healthcare professionals. As Louise said, we refer to people, as in their job titles as if it's starting some functionary purpose. Oh, they're the admin people. They're the people that do the accountancy. Because we're so full of our own bloody egos. I'll say it twice because I can. That we forget that these people run the machine that makes our system work. And if we don't include them in decision making, we don't include them in driving change, we're wasting our time because we think we're too important because we've got X years and qualifications behind us, and they just punch buttons on a computer. We use language about the jobs that puts them down. We use terms about the way that they're trained, which demeans them, because they're, unlike us, haven't got several different classifications of qualification, because they're not health professionals, they're functionaries, because we've got this idea in our head that we're special because we're healthcare professionals, and we need to get over it. And getting over yourself, I think, is one of the greatest ways of getting your team involved with change. So it's time to drop your ego. There's no egos in ecosystems.
Could not agree more, Andy, and I love Mark's
It's Mr.
comment.
Grumpy
Don't
for
be
you, and it's Monday morning.
Mark's
chaos
put
here
a
in
comment.
the UK. Send help.
Yeah, Andy, you're allowed to be grumpy. There's you're dealing with a bit of chaos over there.
Just a little.
Yeah, there's a case in point.
And Mark put the comment in the chat, don't be smart individually, which is really important. And Louise, as you're talking about all of those different roles, you know, that all impact upon the digital health ecosystem, it really brought to mind something that struck me. In Australia recently, just last week, Louise actually announced the release of the Digital Capability Action Plan. I've just totally stuffed up the name, Louise, so do jump in and correct me. Or not. So
no, it's the National Capability Action Plan, which is about building capability in digital health capability in our workforce nationally.
Yeah, thank you. And one thing that really struck me as I was reading the report, because I'm working on a separate piece, which is all around those other roles and the impact they have upon the digital health ecosystem. And as I was reading the action plan, I kept on seeing focus on health courses, focus on health professions, focus on, you know, those frontline staff, but nothing about the accountants or the engineer or the housekeeping, etc., which all also impact upon our health, our delivery of healthcare, particularly if we're focusing on hospitals. I also just want to call out that George also did a comment in the Q&A, agreeing with Andy, which is why we need to collaborate with the entire team in procurement and system design. And I would actually even add, we quite often talk about leading by design, but I would actually say even before we get to the design stage, we need to lead by social impact and consider that first.
Yeah, and Karen, oh, sorry.
No, carry on, please. I've talked enough.
Oh, I was just going to say, the release of that, the announcement that we're doing the work, and the agency, the government in Australia released that plan. But I was watching LinkedIn today and getting pretty disappointed, to be honest, because someone would post and go, "Oh, look, isn't this great?" And then there would be all these comments about EMRs in hospitals, and I was like even within people who think they know digital health, there's still this tendency to focus on hospitals and focus on acute care delivery and EMRs. And I was like, that's like a 20-year-old conversation. Like, if, you know, we're interested in lifting the capability across the entire health workforce, and to be honest, I don't care whether you use an EMR or not. It's sort of irrelevant in some point. So I think that our sector, we still have a lot of work to do to just increase even the awareness and understanding of that we're not talking about teaching you to use an IT system. Like, it's so much more than that. So I was sort of disappointed with a lot of the comments that I saw.
Yeah, I would agree with you, Louise. Very, very much. Okay, so that seems to be I'm not seeing any new comments coming up on barriers. So I'm actually going to hand back to Andy as he leads us through the last part, which we've already started, which is discussing all of these issues.
So, grumpy hat off, back to being Mr. Nice. One of the reasons we've concentrated today on managers and not right at the beginning of this process. This is one of, I think, 3 series of ecosystems we've done around skills for health. We started patients and citizens first for a reason and left the managers to the end. Now, we were challenged about this by some of our members who said, "Oh, but we need to concentrate on managers because without them, none of this will happen." Go away. It's the patients and citizens that matter first, and frontline workers, and that's why we've targeted them first, and we've come along now to look at management. So the big question I always think with these is, I think this must be a first time we've ever finished, and probably because we don't use 7 slides, finished our presentations on time. even ahead of schedule. So that's fantastic. Secondly, and thanks to the people for keeping to time. Secondly, I always try to put in some time at the end of these ecosystem sessions now to say, okay, so what? We've seen need, we've seen best practice, we've heard from Randy and Louise, we've heard from Suzanne and Karen and Sebastian about needs and solutions. But so what? How are we going to actually collaborate together? Where are there potential areas of resources we can share? So the curriculum that we've developed, the skills, the competency frameworks, how can we share those better across our networks? Because we're a global network. This isn't just about keeping it within Denmark or within Australia. How can we share some of that knowledge? And we're quite happy to port that and stick that on a website and share via our community. Secondly, where are there some projects where we can do some work together to better understand each other's work? Whether it's a piece of engaged project work, or whether there's a piece of engaged knowledge transfer exchange, where are those opportunities for collaboration? So where can we collaborate to actually put in practice wider some of the best practices we've seen with some of those needs and barriers? I'm open for input. I think we can use either the Q&A for if you've got some suggestions, but also this is a general discussion for the panelists as well, is what opportunities are there for us to collaborate together, whether it's just between Denmark and Australia, but actually wider around bringing out those best practices we've heard about from Australia and Denmark. Where can we share those? Where are there perhaps opportunities? Because we see funding opportunities from organisations like the European Commission, and I'm sure there's similar ones within Australia too, and wider, to say, where can we actually bake this in as common practice? Because getting it in as a standard is codifying that best practice. So I'm going to stop talking and ask for input. And it'll be an embarrassed silence until someone else speaks.
So unfortunately our participants can't speak, but they can type into the chat. But our speakers from today can speak.
Well, lucky of us, none of us have any strong opinions on this stuff, so.
So come on, where's the no-brainer? Where's the easy way that we can do collaboration? So we've got some resources. We're happy to share those. Okay, so that's number one. That's easy peasy. But what about projects? Where are these ideas where we can do a piece of joint work to further the PhD that Louise was talking about, or to amplify the best practice that Karen and Suzanne talked about? Where can we,
well, Andy, I can give you a time frame if that helps the conversation. So we are hosting the Global Informatics and Digital Health Congress, MedInfo, next year in Sydney in July. So abstracts need to be written by the end of November, but you know, we'll be bringing like thousands of people across the globe. So that could be a good opportunity to use to either present work that could come out of a collaboration, or actually to launch something there and, you know, do the background work that's needed in the lead up to it. That's of interest.
Excellent.
That'll have people from all around the world there.
Wonderful, wonderful. We're up for that. Randy, you had a input, and Suzanne, I can see a hand, even without my glasses.
Great.
You got a yellow hand.
All right, should I start? All right, I'll just start. We have actually tried to do this. We are in a project right now, and that's also where I had my some of the research results from this project called Deliver, which is an Erasmus Plus project. And we are, in the moment, we are developing guidelines, training and teaching material, online material that we are posting on our website. So actually now we're taking notes from all the clever things that we've heard today. So we're just trying to join everything we've heard about best practice, good advice, good tools, and trying to find the best and post. So invitation for everyone to check out the website. I think my colleague just posted it in the chat. There's nothing there, well, not much there yet, but there will be by the end of next year, though, it will be full of good advice. So feel free.
Excellent, excellent. And obviously, you're members of ECH Alliance. We can share that via our website, via our newsletter with the rest of our network.
That would be so great.
So what Adriana and Inez will be in touch with you when you got some material to publish it via our news, because that goes out to 22,000 people. So
that's
just a nice thing to do, to share that project. It keeps the European Commission happy, those nice little bean counters that pay your wages for this. So
I'm sure they'll be really happy.
Yes. So Suzanne, your hand was up.
Yeah, and of course, I think we can share so much and learn so much from each other. So we are, of course, also very happy to share all the material that we have developed here over the past couple of years and the experiences we have from running these leadership programs. It has not been without challenges, of course. Nothing is perfect, and we have changed it and adapted and modified multiple times. And I guess that's also the thing about leadership programs. You have to design it and tailor it for each specific organization context. What might work in one hospital, in one department, might not work in another place. So, and then I think the digital transformation is such a huge agenda. And today I have heard several examples where we talk about video conferences, we talk about automation, we talk about robotics, but there are so many different things you can dive into. So I think also in terms of sharing best practices, learning from each other, maybe it's also about having some focus areas and to say, where is it that we can really bring together and share knowledge? Where is it mature enough to start sharing? And I guess it could not just be relevant for people like ourselves here, sitting here talking. It could also be for some of the practitioners out in the hospitals, for them to get together across countries and share what are they doing. They long for that, they hunger for that. Even within our small region, they want to learn from each other. So I can only imagine the excitement that would also be if they heard that they could actually also learn from someone in Australia, in the UK, and from other places in the world. So happy to be part of that.
Excellent. Your name is noted. We'll be in touch with you. Karen, we're going to come to you next because your hand's up. But before I do that, I got asked this very, very dreadful question. Where's the cash? Because cash makes things work. Cash helps fund things like projects. So where's the cash, either from a national or a wider international framework? Where's the cash in this? Have a think. I should come back for input in a minute. Karen, you were going to say something.
It's almost like you prepared for what I was going to raise. So I just want to note, Georgia has raised about, aged care is the low hanging fruit. And I very much agree with that. In Australia, we've just had it's been a short while now, but we've had a Royal Commission into aged care with a number of recommendations made. And certainly everything we're talking about tonight is extremely relevant, specifically the digital capabilities of managers within aged care and executive within aged care. So I think that is an excellent suggestion to put on the table. We've also heard around, for example, Mark Bromeyer is developing a capability framework for executives and health service managers. And then we've heard from Randy and Karen, who are both developing resources and training packages as well. There is always opportunities within Horizon and Horizon Europe. And I think as I'm seeing the aged care sector coming up in Horizon Europe. So I see that as a possible way of being able to get funding in this area. But the other area that I also wanted to raise was, we've talked around, the training needs, the competency needs, but what about that community of practice needs? And really, I'm starting to set up now to hand over to my other colleague, Mark, to be able to, who is certainly an expert within that area as well.
I was going to say, Louise, I think it's a great, hi everyone, happy morning. I'm not so grumpy as you are this morning, Andy. You're very good. I think it's, as we know, leadership tends to be about the first follower, not the first leader. So I would think when we set up communities, for every community you set up, there has to be the anti-community. So if you have a community, in my world, you grab the top 10 people around the planet and make them the digital managers of the year. And you basically write case studies on them about what it is that they did in their organizations, and you publish publicize the, excuse my language, the hell out of them for basically having adopted a digital ecosystem or something, or some part of it. and make them very, very easy to follow. So if you've got Karen and Suzanne with resources that can basically plug into that, it's literally like, what are the top 10 things I did? And if one of them was having a meaningful conversation with an expert who had to park their ego aside, then you basically tick that off and you put that in the community. And I think if you've got something, if you've got Louise running an event in June, July of next year, you basically make it an awards night or an award or something of that nature that you publish, you can kind of publish against, because then it becomes very easy to follow. There's a date that everyone has to achieve it by, and then you have these resources that you can follow if you want to be like them, if you want to build a community. Because you have to, otherwise it's aged care. Hi, George, I know you can probably hear, and aged care is right for this. The adoption side of it is so hard, and it's just littered with all of these programs that sit in a virtual cupboard and aren't adopted because one person wants to do it, but the rest don't. So I would say find the 10, deal with the 10 that are going crazy about it, and coach them and do it that way rather than trying to boil the ocean. But you can do that nationally. As far as access to money, we can basically help do that. Want to put up some prize or whatever it is, something of value to the wide organization, because we're interested in the adoption of digital as a topic. I'll stop after this, but there've been so many managers that have said to me, middle managers, they're almost afraid to ask the question. If you're a 40, 50, 16-year-old expert in the field and you say, I don't have expertise in digital, if the ego is still there, they're not going to ask that publicly. Whereas if the ego is not there, the keen learners are always learning. They never stop learning. They know they don't want to learn, that they always want to learn.
Interesting.
So we can set up that community if you want to. I can put that environment up in 24 hours if you want to create a little community around that.
Yep, we're up for that. Okay. Other input. I'm just conscious of time because I'm determined we're going to stick to our agenda for I think it's just fantastic. We got so much. We got good ideas from Mark there. Susan's offer and the project offer from Randy as well, and the session next year in Sydney. I think it was Sydney. You said yes, in Sydney. So plus at least four promises. So that's fantastic. Anybody else? Because I'm keen to pick up on this level of interest, this idea of knowledge exchange, etc. The last question I'm going to ask you just quickly before we go to our pit sessions is, who makes you jealous in this field? So who is it that's getting it even better than you? Put your own ego to one side. I struggle, so it's not obviously that easy. But who makes you jealous in this field? Who's getting it right? Who's actually thinking, doing stuff you wouldn't dare to do in the field of skilling up healthcare managers? Who should we be looking to bring into this community that isn't here? Because obviously at the moment we're looking at Denmark and we're looking at Australasia, not small areas, but there are, believe it or not, other people on the planet. Who else is getting it right? Is it the Scots? Is it the Americans? Is it the Norwegians or the Africans?
It's interesting. It's interesting that you mentioned Scotland, because we were just saying Scotland together, Randy and I. Is it Scotland? Maybe? This is really blurry. I know. I'll just send a picture.
You're messing with my mind.
Randy was just mentioning maybe Scotland. There's some of the people that we look a bit towards when it comes to digital health, so they might be a bit advanced. But I'm not sure about the skills for health part. But yeah, it could be.
Okay, interesting. I've got a connection there with the Digital Health and Care Institute. Sanna Rampalen, who's from Finland, who's looking at this area. She's wanting to concentrate on areas such as standards and curricula, as well as driving the change agenda. So we need to bring that input in from a global point of view. Anybody else? I'm just conscious of time.
Andy, it really depends on what area you're talking about. If you're talking about a whole workforce transformation within Health Education England, with what they did with the self-assessment, and now they're trying to implement, minimum levels across the capability areas, is really great example. Whereas, in Wales, there's been some really interesting initiatives coming out of Wales. And then Separately, you're involved, well, the ECH Alliance is involved with a 14-country partnership funded under Horizon Europe that's looking at digital capabilities across all of Europe, and is actually even developing an atlas to be able to map those skills for health across the European Union. So yeah, there's lots of different things happening in different ways.
Okay, excellent. Randy, just quickly, and you need to unmute yourself.
Yeah, just quickly. In this Deliver project, we have Catalonia with us. And Catalonia, they are quite advanced, actually. They have quite big ambitions. They also teach patients, and they have testing of all their healthcare professionals and digital skills, and they are developing a program. They're not finished, but I know they're really ambitious. So maybe we should drag some of them in.
Excellent. And the Catalan's not finished. That's the joke of the day. So moving upward, bring them in. Let's connect them up. Okay. They're also one of our ECH Alliance ecosystems. So we've got partners there with Aquas and the Ministry of Health there. So let's make some connections, because that's important. That's the clues in our name. We're a connector. So let's see if we can get some connections there. Thank you for that, Randy. Conscious with time, I'm going to try and move over now to our pitch session, but before I do, we've also got a global input from the Global Health Connector Partnership we've established. I'm really keen to obviously hear that expertise from Scotland, Wales, and from Europe. But we get quite a lot of that. What's missing is we know that there are best practice examples across Africa, within Kenya, within South Africa, and also across India, and that's missing. Those voices are missing in digital health, and we will do our best with the Global Health Connector Partnership to plug that voice back in. So stay tuned, we will be bringing that input, because it's quite easy for us to say to our partners, say for instance within Africa, who's getting this right there? Who's getting this right in India? Or in other parts of the globe, in Latin America, for instance. So there's that other input needed, because I'm conscious this is quite European, dare I say it, and Australian, obviously. So we need to bring out other voices. Okay, time to move to our pitch sessions, which we're now going to start. I'm going to ask Mark. We do these pitch sessions because we want to bring in voices from people who are in this field that aren't necessarily eminent professors and leaders of large organizations, or even people with BH like me, but people who've got different ideas. So we bring these two-minute pitches in. Mark and also after that, Tom Collins, you've both got 2 minutes. If you get a move on, you've probably got a little bit longer. Mark, over to you. Your time starts now. And you're on mute. We're starting.
There had to be one, obviously, that was always on mute. Am I sharing my one screen? My one slide? Is that coming up? No, hold on.
Yeah, it is. It's just not in PowerPoint mode.
It's not in presentation mode.
There we go.
Great.
Now we can see your presenter screen.
Oh,
you need to click display settings and then
the operating system, so that Microsoft rubbish.
Well, it's late Monday night here.
There we go. Wonderful.
Well done, Mark.
Yeah, of course. Now, of course, I'm missing my other screen. It's all right. There we go. We're not going to bother with that. Can you see anything now or not?
Yeah, now we can see your
just go with your screen there, Mark. Hold on.
That's fine.
Yep.
Yep. You think this would be the first time I've ever done this, right?
It's okay.
No,
okay.
Cool.
Over to you.
There we go. Cool. So my name is Mark Nemes. As a founder of an EdTech, there's a few truths that we come across on a daily basis. Number one, 80% of adult learning is informal. Like what we've experienced today, it's informal and peer-to-peer. We're learning from experts in a field, but it's not necessarily a formal course. Number two, content is not the problem. We actually all have generally too much of it. It's the context that we find. We don't have the time to wheel through it. We basically want to have less steps in a process, not more. Any clinician in a process would want to have less steps, not more steps added to a process. And the third is that most of the knowledge required to advance frontline care already generally exists within the frontline clinicians that we actually already know. What's happening in Africa, how they're using digital health and their managers already exists there. They already know it, they've already done it. Somebody has those ideas around it. It just needs a digital nudge. The first nudge has tended to be free tools, Facebook private groups, maybe some WhatsApp chat groups or things of that nature where people can discuss things with each other. And they're very good. The tools work, but we know we're swapping our privacy in return for the convenience of using those tools. We know you're being served ads on those tools. We know we're actually being tracked, even if it's secure sort of point to point. So Content Labs exists. So how do we support informal knowledge formally at scale and trust? So we've built a white label bit of software that we call Community Labs Engine that allows trusted individuals and their associations to basically manage rapid communities of practice. And what is a community of practice normally? It's normally resources, case studies, chats, forums, search, and learning. That's normally what happens in a community of practice. So we were born out of a clinical trial that we did in dementia education and management. And what we're looking for around the world are those organizations that are trying to do some sort of knowledge change at scale around a medical process or procedure. So there's no advertising, there's no selling of data. It's just peer-to-peer learning in the context under organization's own brand. So if you have a health challenge or a clinical trial and you need to educate a channel or a colleague or a clinician at scale or the public, we'd love to basically hear from you. And I'll take it on advisement that should be just bang on 2 minutes.
Splendid, absolutely wonderful, and sneakily just snuck in under 2 minutes. So that's fantastic, Mark. Thanks for that, and thanks for the work we did the other day. So next up, with your 2 minutes, let's get you up and ready on screen, Tom. And then when you're ready to go, I'll start the clock.
Great. There we go. Well, yeah, thanks everyone for the opportunity to catch up. Fantastic to hear from across the world on what's going on. MedUp is a clinician lifecycle management tool. So we focus on the orientation, skills-based education, hospital quality improvement, and then the well-being of the individual clinicians. We are fortunate to be supporting about 65 facilities and about 33,000 clinicians around the world. We orientate about 30% of Australia's medical interns and an increasing number of nursing and midwifery graduates and students. We've done a bunch of time in motion studies that show that 1 minute in the app saves about 5 minutes of productive clinical time. And for managers, which is the focus of this group, really the goal for our platform for managers is to increase the engagement for your frontline clinical staff. So through our processes and the platform, we're able to automate and target clinical engagement and reduce admin costs by about 1.15 of an FTE, which particularly now during COVID and certainly post-COVID is important. So you can get that productive admin and management time back to build rapport and provide that pastoral care for your teams. And then obviously minimize the use of paper and reduce some of those clunky processes and systems that seem to break pretty quickly during COVID. What we're finding is that increasingly there's been a large casualization of the workforce and that ability to be able to bring people up to speed, assimilate them in, and create a really unique and personal experience for them and support their education and then ongoing well-being. It has been or had traditionally not necessarily well addressed, but now becoming an even critical standpoint as people become more burnt out and move around between facilities. So we'd love everyone to be using the platform, but we know that's not possible. So we have a bunch of resources available on our help center that for teams that are just looking to improve their engagement with their clinicians, whether it be through efficient orientation, learning more about their offboarding process and what they can do to improve their services locally with their tools. And we've got lots of information there as well. So thanks again for the opportunity and hopefully can contribute to the communities going forward.
Brilliant. Brilliant. I will make this following offer, but both you and Mark, well, when we write up and share the resources from today, we're more than happy. We share the resources we've done today, presentations, but also if you've got some written content we'll publish that as part of the write-ups from this. So there's a bit of free advertising for yourselves, both you and Content Labs as well. So that'll be that offers there for you both there. Conscious of time, I want to finish on time. Firstly, to thank all the speakers who've taken part today. Great input. I'm energized and excited to see, I think, at least 4 tangible areas where we can collaborate and share some resources, share some knowledge, take part in each other's events. We've got some quite distinct offers on the table. We will be coming back to people with a write-up and follow-up from this, and also publishing details of our next event gathering. But again, thanks for all our speakers. Particular thanks for input from Louise and from Randy, and also from Karen, who I think showed some great insight. My last thing before we close today is to thank Karen and Caroline for organising today's event and bringing a fantastic range of speakers together. I don't know if either of you got any input before we close.
I do. So our next event is actually the one that's most close to my heart and my research area, is around the specialist digital health workforce. So these are the roles of, a digital health or health informatics type roles. It's the roles that support the delivery for all of the patients or citizens and the carers, the frontline and the health service managers. So I'm really looking forward to being able to do that next event with my colleagues in Denmark. And over to you, Caroline.
Yeah, thank you. Sorry, a bit sharing a screen here. But yeah, that would be great. We can't wait to do it. We will send out the date as soon as we can and invite you all for the next part. Thank you.